These are the symptoms which terrify me as a midwife in that postnatal period, and I want all new parents to watch this. Save this so that you are aware of the symptoms to look out for postnatally, and call your maternity lines as soon as you can if you have any of these things appear. For anyone who hasn't met me yet, hi, I'm Angie. I've been a midwife for over 13 years, and you can hit the follow button for more pregnancy, birth and parenting information. Number 1, they phone up day 2, day 3, and they say my baby has slept all night and isn't waking for feeds. Sometimes sleeping a very long time can lead to low blood sugars in babies. It can also be a sign of jaundice and also sepsis and infection too. But if your baby hasn't woken you after 4 or 5 hours, it is worth stripping them off, getting them skin to skin, changing their nappy, sometimes just washing their hair with some water and cotton wool, and then getting them fed with whatever you are feeding them, whether that's express breast milk, whether that's directly breastfeeding, whether that's a bottle feed. If your baby is not feeding at that stage, you should be calling your maternity units for individualised advice. Similarly, with jaundice in babies, if they start turning yellow on their skin colour, or they start getting yellow whites of the eyes rather than being white, if the gums are starting to turn yellow, for black and brown babies, if you were to do the Blanche test, so you pop your finger on their palm, you can notice some yellow discoloration. This all needs you calling your maternity unit for individualised advice. Other symptoms to be aware of are really fast breathing rate. If they are starting to make a singing noise when they breathe, like a In addition, if baby is cold centrally, is starting to turn blue, is floppy, you need to be calling 999 urgently. So for mums, the signs and symptoms to be aware of when you go home. Again, preeclampsia can happen in the postnatal period. So headaches, visual disturbances, so stars in your eyes, upper abdominal pain just here underneath your ribs that's suddenly there and sharp, sudden swelling in your face, hands and feet. All signs where you need to call your maternity unit. The next symptom that worries me is having to change your maternity pads every 1 to 2 hours because they are completely saturated front to back all the way through, leaking. This is a sign that the blood loss is too heavy. Clots the size of a golf ball, feeling like your heart is racing, and sometimes abdominal pain, lots of abdominal cramps. And if you have those clots on a pad, take that in with you to the maternity unit when you get assessed. Signs of infection: feeling hot, cold, shivery, nausea, vomiting, feeling like you're coming down with flu and fever, high temperature over 38 degrees. Again, abdominal pain, smelly, offensive bleeding, or smelly, offensive loss coming from a wound if you've had a caesarean birth. This all needs an urgent referral to your maternity unit. And the final symptoms that worry me for mums is signs of a blood clot. So if you've got redness, swelling, inflammation, if one leg is hot to the touch down one side, and especially if you're getting chest pain, breathlessness, you feel like everything is tight up here, you need to be calling your maternity units ASAP and getting assessed. Because of increasing medicalisation, because of increasing surgical births, it is increasing readmissions for infection, blood loss, and also blood clots after birth as well. So all of these things you need to be aware of, the signs and symptoms. Your maternity units are open 24/7 and they are available to you until you are 28 days postnatal. So keep those numbers so that you can call them at any time, day or night, 365 days a year, and get assessed. And just for some reassurance, none of these really terrify me as a midwife, as long as the moment you have these symptoms, you call your maternity units, because the earlier that you call up, you let us know, the earlier that you will come in for an assessment, the earlier that treatment will begin for whatever it is, and so safety really improves for both mums and babies, which is amazing. Understanding the signs and symptoms helps with the assessment, and that improves safety for everybody and outcomes. Never be afraid to call your maternity unit, that's exactly what they're there for.